Hey everyone, and welcome back. Today, we're diving deep into something that affects so many of us, chronic health conditions.
Oh, absolutely.
I'm talking about things like arthritis, asthma, diabetes,
Yeah.
heart disease, those conditions that really need ongoing management. We've got a ton of research here, and I've got to say, there's a real game changer out there called chronic care management, or CCM.
That's right, CCM. It's this model of care really designed to help folks better manage those chronic conditions.
Yeah.
And it's making a splash, in the healthcare world.
Okay, so let's break it down for everyone listening. What exactly is chronic care management?
So CCM is really about dedicating somewhere between, say, 20 to 60 minutes each month
Okay.
to coordinate care for patients with these chronic conditions. And the cool thing is, a lot of this happens remotely.
Oh, interesting.
So it really supplements those regular visits to the doctor's office, not a replacement, more like you've got a dedicated team giving you that extra support between appointments.
So it's like having a health coach in your corner,
Exactly.
helping you stay on track with your treatment plan. I can see how that would be invaluable if you're dealing with multiple conditions.
Yeah, absolutely. And it's all guided by this personalized care plan developed, hand in hand with the patient's primary care provider. And the plan, it outlines their health goals. It looks at potential challenges and really zeroes in on strategies for managing those conditions effectively.
Sounds like a win-win for both patients and providers.
It really is.
So who exactly benefits from this?
So from the patient's perspective, anyone with 2 or more of those chronic conditions lasting at least 12 months, they're eligible for CCM under those Medicare guidelines.
Which is a lot of people.
It is. It's a big chunk of the population.
We were looking at some data earlier, and it's kind of startling how many people are living with multiple chronic conditions.
It's definitely a growing concern, and CCM is designed specifically to address, those complexities of managing these conditions. For patients, the benefits are huge.
Give us some examples.
So CCM, it increases compliance with those recommendations from the provider between those visits, helps those patients really focus on their overall health and wellness, and gives them easier access to valuable resources.
So it's not just treating symptoms. It's about giving patients the tools to really take control of their health.
You got it. It's about empowerment. And by staying in close contact with their care team, any new concerns can be caught earlier, potentially preventing bigger problems down the road.
That makes sense.
We've seen patients actually report feeling, more motivated, more confident about managing their health thanks to CCM. One participant even said, "I feel more motivated to do what's right and take better care of myself."
Wow, that's really powerful. Sounds like CCM is truly making a difference in people's lives. But what about from the provider's side? How does this benefit them?
So there are some significant financial incentives for providers who offer CCM Medicare. They reimburse, an average of $62 per month for each patient enrolled in a CCM program. But honestly, it goes beyond the financial side of things. CCM can actually help providers achieve those better patient outcomes, reduce those ER visits, reduce hospitalizations, boost patient satisfaction, even improve their quality performance scores.
So it sounds like CCM can really transform a practice, but I imagine implementing a whole new system could be, kind of daunting.
It can be, but thankfully there are companies, like Wellbox, that make it easier for practices to get started. They have this turnkey solution that includes, licensed nurses to handle that care coordination, administrative support to manage the program, and they even have this seamless integration with existing electronic health records.
So providers don't have to reinvent the wheel
Exactly.
or overwhelm their staff. That's a huge relief.
Exactly. It's all about making CCM as accessible and efficient as possible for both providers and patients.
This is really fascinating. We covered, how CCM works, the benefits it offers. But let's zoom out a bit. What kind of impact does this have on the healthcare system as a whole?
That's where it gets really interesting. CCM could really make a dent in healthcare costs. Imagine if we could prevent even a small percentage of those trips to the ER.
Yeah, give me the numbers.
So studies have actually shown that something like 30% of those ER visits related to chronic conditions, they could potentially be prevented with better management.
Wow.
And when you think about how avoidable healthcare costs in the U.S. are estimated between $300 to $500 billion annually, the savings could be massive.
Those are some eye-opening statistics. So we're not just talking about improving, individual lives here. We're talking about a more efficient and cost-effective system for everyone.
It really is.
A win-win-win.
Exactly. And as more people become aware of CCM, we're likely to see, even greater adoption. leading to better health outcomes for patients, a more sustainable healthcare system, and potentially billions of dollars in savings.
This is definitely something worth paying attention to. Whether you're dealing with a chronic condition yourself or, just care about the future of healthcare, CCM is a model worth understanding.
Yeah, it really is. And one of the things I find really interesting about CCM is how it aligns with that whole shift towards value-based care.
Now, there's a term I hear tossed around quite a bit these days. Could you maybe unpack that a little for listeners who might not be familiar?
Sure. Value-based care is really about, moving away from that traditional fee-for-service model where, providers are paid based on how many services they provide. Instead, it's all about delivering the best possible outcomes for patients. So quality over quantity.
Makes a lot of sense.
Yeah.
So how does CCM fit into all of that?
So CCM, it really incentivizes providers to invest in that proactive care.
Okay.
So by spending that dedicated time, coordinating care, engaging patients between those visits, providers can prevent complications, reduce those unnecessary hospitalizations, and ultimately improve health outcomes. And this, in turn, leads to lower healthcare costs overall, which is a win for everyone.
So it sounds like CCM isn't just about managing those chronic conditions. It's about transforming how we approach healthcare as a whole.
You got it. It's about shifting from a reactive system to a proactive one.
We've painted a pretty optimistic picture of CCM so far. But I'm curious, are there any challenges or, limitations that we should be aware of?
That's a great question. One of the biggest challenges is, making sure patients are engaged. For CCM to be successful, patients really need to be active participants in their care plans and communicate regularly with that care team.
I could see how that could be a hurdle. It requires a certain level of commitment from the patient.
Yeah, for sure. And there are, some other logistical things like, how do you integrate CCM into existing workflows and making sure data privacy is maintained. But the good news is that there are resources out there, some support systems to help with these challenges. Companies like Wellbox, for example, they not only provide the technology for CCM, they also offer, training and support to help practices implement these programs and make sure they're running smoothly.
That's good to hear.
Yeah.
It sounds like CCM is more than just a good idea on paper. It's actually a practical solution with a lot of potential.
Exactly. And as technology keeps advancing, we're likely to see, even more innovative ways to use CCM to make patient care better. Imagine AI-powered virtual assistants helping patients stay on track with their meds and appointments. Or, personalized health insights sent right to their phones. There are a lot of exciting possibilities out there.
Wow, that really is a glimpse into the future of healthcare. It sounds like CCM is at the forefront of a really exciting evolution.
I think so. But even with all of the cool technology, the human element, that personal connection, will always be at the heart of CCM. It's about building strong relationships between patients and their care teams. It's about fostering trust and empowering individuals to take an active role in managing their health.
That's a really great point. It's not just about, data and algorithms. It's about that human connection. And compassion.
Yeah, exactly. And that's what makes CCM so powerful. It combines that cutting-edge technology with compassionate care, creating a much more holistic way to manage those chronic conditions.
Okay, so we've talked about how CCM works, the benefits and some of the challenges, but let's bring it back to our listeners. Why should they care about this?
Whether you're living with a chronic condition or have loved ones who are, understanding CCM can really help you advocate for better care. It's about knowing that there's a system out there that can give you that extra support, improve health outcomes, and even potentially reduce those healthcare costs.
It's like having another tool in your healthcare toolbox.
Exactly. And knowledge is power. The more you know about CCM, the better equipped you'll be to navigate the healthcare system and make smart decisions about your health or the health of your loved ones.
So if you're feeling overwhelmed managing a chronic condition, don't hesitate to ask your doctor about CCM. It could be a game changer.
And if you're a healthcare provider, I encourage you to explore what CCM could do for your practice. The benefits are clear. And, companies like Wellbox are making it easier than ever to get started.
This has been a really insightful dive into CCM. We've learned how it works, why it's important, and the potential it has to change healthcare as we know it.
Well said. CCM is a perfect example of how technology and compassion, they can work together, create a more effective and patient-centered way to approach healthcare.
If you want to learn more or connect with us, please contact Wellbox at www.wellbox.care. And that's a wrap on this episode of The Deep Dive.